Hi everyone, it's Sarah again, registered nurse. I'm here to coach you through the coronavirus outbreak by explaining to you how you can keep your lungs oxygenated and healthy, especially if you're sick. There's 3 ways to do this. 1, breath work, 2, positional therapy, and 3, physical exercises. In my previous video on pneumonia, I explained what happens when you take a breath in. Please watch that so you can fully understand why breath work is so important. My treatment video also explains how you can combat this virus and the pneumonia that it's creating by hydration therapy. Please watch those videos and add this video into your treatment regimen. Deep breathing is extremely important, especially if you're sick with this virus, because when you take a breath in, the air goes into these little balloons. The blood meets the balloon after getting pumped from the heart to take oxygen from it and goes back to the heart, pumps, goes back to the body. That's the basics of breathing. When you take a breath in, the balloons inflate full of air. These balloons will collapse if you're not doing deep breathing exercises, especially if they're full of mucus and fluid, which is what the virus is creating, called pneumonia. Let's do deep breaths in, fill those alveoli, those little balloons, so they don't collapse. They stay open and you can get better oxygen exchange. Every hour, set your alarm. You'll do 6 deep breaths, and at the top of each inhale, you're gonna hold for 5 seconds. It looks like this. Exhale slowly. At the top of the 6th inhale, you're gonna hold, and then after 5 seconds, you're gonna cough. That's gonna start moving some of that mucus that's building up in the alveoli, which is pneumonia. Gonna get that mucus moving so you can cough it out. It's very important that the mucus start moving out of the alveoli so you can keep getting that oxygen exchange. So breath work. Every hour, 6 deep breaths in, hold, and then release. That's gonna keep those little balloons fully inflated so you can get better oxygenation. It's very important. Now we're gonna move on to positional therapy. After that 6th breath in, you're gonna wanna lay on your stomach for a little bit. The reason to lay on your stomach is because the lungs are further back on the body. So if you're laying on your back, you're kind of pushing on the lungs and they can't fully expand. You can set an alarm, 5 or 10 minutes. Do rhythmic breaths, deep ones, in and out. That's gonna help expand your lungs, get full expansion of those alveoli. It'll increase lung health and oxygenation. Lay on your stomach for a little bit after that 6th breath every hour. Positional therapy also works by switching it up side to side. Imagine you have a bunch of mucus built up on this side and you're laying on this side. Well, this lung is getting great oxygen exchange, right? Well, this one isn't. You need them both to be getting good oxygen exchange so one lung doesn't start collapsing. It's very important that you switch it up. So if you lay on one side, switch it up. You know, your hydration alarm is set every 20 minutes. Go ahead and do positional therapy every 20 minutes. So that's how positional therapy works. You can also do physical therapy where you can lift your arms up. The diaphragm lives here. That's what lifts up and opens your lungs. The lungs don't have muscles. The lung's not a muscle. The diaphragm does that. So you need your diaphragm to help open up your lungs to get oxygen inside to those balloons to get the exchange. So how about you help your diaphragm out every hour by lifting your arms up? It'll expand your lungs. It'll also be good exercise. So lift those arms up. You can do this a few times. That'll help you. So those are 3 ways you can get really good oxygenation through this time. Breath work every hour, 6 deep breaths in, hold at the top for 5 seconds. At the end of that 6th one, take a big cough. Then lay on your stomach for 5 minutes. Do rhythmic, big inhales, exhales. That's going to keep your lungs fully inflating and getting oxygenation into the blood. You can do positional therapy by going side to side. You can do physical exercises where you're lifting your arms up, opening up the lungs, really getting good oxygen flow that way. And if you have someone that's in the room with you, which we don't recommend because you should be isolated, but if you're a young person or an older person and someone's helping you, they can do percussion on the back of your back. And that's going to help loosen the phlegm and mucus so you can cough it out. The hydration therapy can thin it out. So watch my video on pneumonia. Make sure you watch the treatment video and add these 3 simple ways to combat pneumonia at home with really good oxygenation with breath work, positional therapy, and physical therapy. Thank you so much for watching. From my house to yours, take care.